Hello everyone, today let's learn about antenatal care. Okay, so definition. Antenatal care, it is a systematic supervision of a woman during pregnancy. Okay, so why we call it systematic? Because there are certain things that is done in the month, in the first trimester, certain thing done in second, third, and fourth. So it is a systematic supervision, and the supervision should be regular or periodic in nature according to the individual needs. That means some mother might be a high risk mother, so maybe the doctor might advise her to come every month for her regular checkups. But whereas with a mother who is a normal who has a normal pregnancy, for her she might be called every trimester. Okay. Now, goals and objectives. In goals, first is to screen the high risk cases. Very important. The mother should be screened for high risks from the time she is registered for her pregnancy. That means from first trimester till the delivery she should be screened. Number two, the mother should be educated on the physiological changes of the pregnancy, what is normal and what is not, when to seek help. Those should also she should be educated on that, and also about the labor, so that she is at ease. Number three, the mother or the couple should also discuss about the place where she will be delivering, mode of the delivery, that is provisionally, and care of the newborn, that also should be discussed. Place means which facility or hospital will she be delivering her baby, mode of delivery, that can be normal vaginal delivery, a cesarean delivery, provisionally which she prefers, and then care of a baby should also be discussed. Number four is uh, uh, to motivate the couple about the needs of the family planning. That means a healthy spacing should be promoted, and here we should also educate the mother about the family planning. And uh, and if in case of a couple who is seeking for medical termination of pregnancy, she should also be, or they should also be guided appropriately. And then after that, our objectives are to promote and maintain maternal and fetal well-being, ensuring the successful outcome of pregnancy through safe delivery of healthy newborn by a healthy mother. Okay, so component of ANC. First is there should be 4 ANC visit. After that, history taking, physical examination, lab investigation, immunization, supplements, iron and folic acid and calcium supplements, health education, and birth preparedness. Okay, so now let's learn about the components of antenatal visit one by one. First, ANC visit. The first ANC visit should be done within the first trimester. That means within 3 months after the confirmation of the pregnancy. This is very important. That is, hence we also categorize mother into early registration and late registration. A mother who register herself within first trimester, we called her as a early registration. And after that, a minimum of 4 visits throughout her pregnancy should be encouraged. But according to WHO, it says 8 ANC visit is must. Now, history taking. So first we need to collect the demographic profile, which is age, name, address, marital status, occupation, education, height, weight, etc. Okay, after that, ask for take obstetric history. Ask for last menstruational period so that we can calculate the EDD of the mother or of the baby. And then GPAL. GPAL means the G for gravida. Gravida means it is the number of time a mother has been pregnant, and regardless of the outcome, how many times she has been pregnant. Uh, that is called gravida. Parity is the number of pregnancy that has reached the age of viability, and that regardless of whether the baby was born alive or stillbirth, IUD. Okay, so that is parity. And A is for abortion and L is for life. So right now, how many children or a child does she has. Okay, that is L. And outcome of delivery, which means whether it was live birth, stillbirth, IUD, what was it? So that we need to ask. Mode of delivery, whether it was proper spontaneous normal vaginal delivery, or whether it was assisted delivery, that can be a forceps, use of a forceps or vacuum. So those things we need to ask, or cesarean section. And also we need to ask about the any complication during pregnancy, that also we need to ask. Maybe that can be PPH, PIH, anything, obstetric labor. So those things we need to ask in detail. After that, medical history. So in medical history, you need to ask, does mother has any chronic illness? That can be hypertension, diabetes, tuberculosis, and any other chronic diseases. Okay. And also ask the mother for, and right now, any currently any medication she is taking or not. That also should be asked and mentioned in your documentation. And then ask for the allergy, that can be food allergy or drug allergy. And now number 4, surgical history, very important. Ask if she is G2 or G3. Ask mother if she's not primary. Ask the mother about her previous cesarean, if she has done the previous cesarean, whether she has done a previous cesarean or not. Or also ask for any lower abdominal surgery, that can be a surgery of a fibroid, cyst, anything. You should ask the mother. And also ask for any complication during anesthesia or surgery she might have faced. Okay, number 5, family history, very important. Any genetic disorder, those kind of, so that we can rule out congenital anomalies. And history of congenital disorder, that also, if she is G2, G3, we can always ask how, whether the previous child or a baby is normal or not. And then chronic diseases, whether she has a family history of hypertension, BP, sorry, diabetes, those things we need to ask. Now let's learn about physical examination. Once the mother has come to your facility, start with the vitals, checking of the vitals. After that, anthropometric measurement, very important, height and weight, and calculate the BMI of the mother. After that, head to foot examination should be done. In eye, check for pallor and icterus, and in mouth, check for gums, any bleeding or any swelling is there or not, check. And also check for central sinuses. In the face, see any abnormal swelling is there or not, and also check for any cholisma also. Okay. After that, in the neck, check for any thyroid enlargement of the thyroid is there or not, check. And in breast, check for tenderness and inverted nipple, very important. Inverted nipple should be corrected during ANC time, so that it does not interfere with the feeding after the delivery. And in hands and feet, check for any pedal edema. And then in the nails bed, check for any pallor and sinuses. This is important. And you also have to do a abdominal examination after uh, 24 weeks of gestation. And then you also need to do a per vaginal examination. Okay, once the mother is at her 37 weeks of gestation. Okay, so in lab investigation, these are the lab investigation that we need to do. First, hemoglobin, blood glucose. Blood glucose, we do both random and OGTT, oral glucose tolerance test. Hepatitis B, VDRL, which is syphilis, HIV, urine albumin, blood grouping, and USG. These are the lab tests that we need to do. Now coming to immunization. 2 doses of tetanus and diphtheria vaccine should be administered at the interval of 4 weeks. Okay, but the first dose has to be taken during first trimester of the pregnancy. That means within 3 months of the pregnancy, and after that the gap should be 4 weeks. So now supplements. In the first trimester, which is 0 to 12 weeks, the mother is advised to take a folic acid tablet, which is of 400 microgram daily. After first trimester, then first dose of albendazole is given to the mother, which is just a single dose, one dose, and which is of 400 microgram. Okay. After that, we start iron and folic acid, where the iron is 60 microgram and folic acid is 500 microgram. Okay. And then after that, calcium tablet also should be taken daily. 1 gram elemental calcium should be taken. Okay. And calcium and iron should not be taken together, it should be taken separately. Okay. And then after that, the duration of iron and calcium supplements. See, one thing which is very important here is this iron and calcium tablet should be taken 180 days during pregnancy and 180 days after pregnancy, which means 6 months during pregnancy and 6 months after the delivery. Also, the mother should take iron and calcium supplement. Okay, so now let's learn about health education. First, nutrition. A pregnant mother's plate should contain all the nutrients, which is carbohydrate, fats, protein, minerals, because we expect the mother to increase her weight by 1 kg every month, and during her pregnancy or by the time she is ready to deliver, uh, she should put on at least 9 to 11 kg of her weight. Physical activity, encourage her to do exercise or yoga, whichever she prefers. Number three, she should be well hydrated. Number four, meditation, very important to reduce stress. Number five, ensure supplements are taken regularly, which is iron and folic acid and calcium. And she should also be educated on the danger sign. If she finds any danger sign, she should seek immediate medical help. Okay. After that, rest and sleep, and then avoid harmful substance that is cigarette, alcohol, those things she should avoid. And breastfeeding education during her antenatal care, she should be educated, she should be taught about the breastfeeding, importance of breastfeeding and how to breastfeed. After that, family planning, this is very important, and family planning should also be taught during the antenatal care. Now, finally, birth preparedness. So, what is birth preparedness? It is actually an advanced planning and arrangement made by the pregnant mother and her family to ensure a safe delivery and immediate care of a newborn baby. What are the components? So, the first is to identify the place of delivery, which hospital she will be delivering the baby. Number two, selection of the birth companion. Birth companion is somebody who will be with the mother from the time she is admitted in the hospital till her discharge. That is birth companion. And then after that, transportation, arrangement of the transportation. Number four, she should also have an emergency contact number of a family member, or also, and also Asha's number. And number five, it is the financial planning, which is arrangement of the money should also be considered. Number six, hospital bag should be packed, that is like the items that is required during her stay in the hospital. And then arrangement at home, so that preparing the home environment for the new arrival, that can be cleaning, beddings, warm clothes, etc.
Thank you. If you find it helpful, then please do share with your friends and do not forget to like and subscribe. Until then, see you in my next video.